Welcome everyone. Thank you for being here. I'm Sharon Bogan from Communications of Public Health Seattle and King County, and I'll go ahead and turn it over to our host.
Yes, good afternoon everyone, members from the press. I welcome you to Asian Counseling and Referral Service for this really important press event to address the concerns around the coronavirus and to make sure that there's accurate facts and information, and also to address and counter stigma. And we are so fortunate to have this leadership from our communities, both from the public health and King County, along with our community leaders and community members here. So with that, I'm going to turn it over to our County Executive, Dow Constantine, for his words. Thanks.
Well, thank you, Michael, and thanks for hosting us today at Asian Counseling and Referral Service. I'm honored to be here among community leaders from across our region. We will be providing an update on King County's coronavirus response, and you're going to hear from some of these leaders who are working diligently to provide accurate information to reach all of our communities. Coronavirus continues to be a very serious global issue. There is no sustained transmission in the United States at this time. But this is an evolving situation, and Dr. Jeff Duchin will be speaking to that more later. Our public health staff are doing an amazing job, with over 100 staff now involved in the coronavirus response. They're assessing people who are for the risk of contracting the disease. They're testing people who have recently traveled to China or who are exhibiting symptoms. They're monitoring anyone who has been in close contact with people who are under investigation and arranging for isolation or even quarantine where necessary. On top of all this, we're working with our community partners to disseminate credible information, to calm fears, to dispel myths. Many of our partners here today are working to support community members by answering questions and equipping employees with the information they need. This is a collective effort. Many of us are concerned about what people in our communities may be experiencing, including possible stigmatization or discrimination based on fear. We are not going to allow misinformation to take hold in our community. Stigma does not fight illness, but sharing accurate information, especially during a time of heightened concern, is one of the best things we can do. We are here today because we are united in our response. I'm pleased now to welcome to the lectern Patty Hayes, the Director of Public Health, Seattle and King County.
Thank you, Dow. So appreciate you being here today. And I know you have a busy schedule and are going to need to leave, but we all are so appreciative for your voice and support on this important issue. And I want to thank you all for being here and welcome you on behalf of our host, an amazing resource, the Asian Counseling and Referral Service. I'm happy that I'm standing here today with health, with community, and with our government leaders. As Dow said, we're going to be updating you later on all that we're doing to keep our communities safe, because now is the time to unite. And I want to reiterate something Dow already said, which is there are 0 people in King County who have tested positive for the novel coronavirus. And the risk to the general public here in our region and across the state is low. We in public health are working in 3 main areas. First, we're providing accurate guidance and information. Many of you have been working diligently to provide the best information to community members possible. We need all to know that we need to do more and we need to keep coordinated. That's why we need all of you to continue to provide accurate information. In our meeting down, we just finished with our wonderful community members downstairs. We agreed to set up weekly calls to brief our community on what is the latest accurate information. So we're seeking ways as government to look what we can do better and to keep better connected, to keep misinformation from being out and about. Secondly, public health, as you've heard, is monitoring potential cases of coronavirus and coordinating with the healthcare system so that we can detect any infections as quickly as possible and reduce the risk of spread. We have a strong public health system here that's able to respond to these type of situations, and we're happy to be present in community to reinforce that message. And very importantly, we need to address and prevent stigma. Your race and ethnicity does not put you at any additional risk or make you more likely to get sick. Let me say that again. Your race or ethnicity does not make you more at risk for this illness. We've heard of a number of harmful situations in the community, and we need to be forceful in saying no discrimination of any kind is going to be tolerated. As a white person, I am as likely to become exposed, maybe more so because I'm a nurse. I am more likely to become exposed if I had been in close contact as anyone anywhere. It's universal. Showing fear or hostility towards someone based upon how they look is not only wrong and hurtful, it can harm our ability to keep everyone healthy. Public health needs to be able to work nimbly and with all. And the more we get into othering people or putting something in a category can inhibit my work in public health to make sure that everyone is safe and healthy. To be successful in containing coronavirus, we need everybody to feel welcome to seek medical care when they feel sick. As public health professionals and community experts, we know that protecting the health and safety is not only about safety from a virus. It's about creating communities where people can support each other and where we all have the basic needs met. We acknowledge that people's past history and their trauma can get exacerbated during times of stress like this. Instead of acting from places of fear or stigma, we want to, by having the correct information, put out that we can help understand that there's a low level of risk from the current coronavirus. Plus, we can understand the great harm we can make with stigma and discrimination towards certain people or communities. I encourage you, everyone in this room, to speak up if you hear, see, or read stigmatizing or harassing comments or misinformation. If you're hearing information that sounds scary, it may not be true, and you can check for accurate information at our King County website or Washington State's coronavirus website. We need to support our neighbors to remember that we all belong here. When we do this, we're strengthening the health of our whole community and our whole overall health system. And one way we can do this is by showing up and connecting with our friends, families, and the amazing cultural spaces in our region that we have to offer. This weekend is a great opportunity to experience that at the Chinatown International District Lunar New Year celebration and their events. We are taking public health actions to protect and prevent a local outbreak and to be prepared if the epidemic comes to us. Our health system is stronger now because of our cooperation in our community. I've been deeply proud to see the many ways public health, community organizations, schools, and other governmental agencies have been working together. Connection is the antidote to fear and isolation. And clearly, we have a lot of that here today. Next, I'd like to introduce Teresita Bateola of the International Community Health Services, a great partner and a wonderful friend. Teresita.
Thank you so much, Patty, for the introduction. International Community Health Services is a community health center with many clinic sites around King County. So I'm here as a great partner to public health to tell you that public health is really doing a great job in letting us know about the latest information and keeping us informed in terms of what to expect. Because International Community Health Services serves many Asian Pacific Islanders and other immigrants and refugees, we were very quick to act. We immediately made sure that we had appropriate triage processes in place, both if people called over the phone or if they presented themselves in the clinic. We had clinical workflows where we were prepared to take them into either isolation rooms or negative pressure rooms. We have electronic health records where we can enter information and track people who might have symptoms, and we are communicating very, very closely with public health. And I will tell you that we have had zero patients who have been diagnosed with coronavirus. But we do hear widespread reports of those who look like they're Chinese or Asian experiencing stigma or racial profiling, that they would have coronavirus. This is a public health issue that we must all work together on, and rather than building on fears and building on suspicions, everybody should wash their hands, act as if you're doing your best to prevent transmission of any kind of flu. The steps that we have taken as a clinic are steps that we have in place, that we put in place and act on every single flu season to make sure that everyone that we serve stays healthy. So to say that coronavirus is different at this time is not the case. Prevention is the best course of action. And like Patty, I would encourage everybody to continue to participate in activities in our communities because we have had zero reports in King County that we have coronavirus. Now I will turn this over to Lalita Upala, who is with the King County Commission for Refugees and Immigrants.
Thank you, Teresita. Hello, everyone. I'm Lalita Upala, the chair of the King County Immigrant and Refugee Commission. And the first thing people can do about coronavirus and the fear that is surrounding it is to learn the history of stigma around the Chinese and broader Asian American community. As Patty mentioned, the stigmatization, bias, and racism that is occurring is not new, but is built on years of history and is harmful, painful, and has mental, physical, and economic impacts to our community. Going back to the 1800s, medical institutions, unions, and government entities promoted racist messages about how Chinese men and women were more likely to carry disease, barring them from entering the country, excommunicating them from the workforce, and further socially ostracizing them in the public. There are also important differences in cultural practices that many people may not be aware of. You may see people wearing masks and make assumptions about whether or not they have the coronavirus. What you should know is that in many Asian countries, wearing a mask is actually quite common. Many people are accustomed to wearing masks to avoid pollen and to, as a courtesy to others when they have the common cold and other cultural or social reasons. Seeing someone wearing a mask does not mean that they are ill. Additionally, it is flu season. So there are many other reasons besides coronavirus for people to be ill. There is no reason to assume everyone wearing a mask who is sick has the coronavirus. We are asking for your support, compassion, and active intervention if you see or hear stigmatizing words or actions. We also encourage you to come celebrate with us as a community around the events around the Lunar New Year get involved, and build relationships with people across our communities. Thank you so much.
Good morning. I'm Jeff Duchin. I'm the Health Officer for Public Health Seattle and King County, and I'd like to thank our community partners for providing us this opportunity to share a lot of information with you today, both about coronavirus and about stigmatization. Let me start first by, again, providing a quick update about our public health response and the current status of the outbreak. Who's at risk for novel coronavirus infection? People who've traveled to China in the last 14 days, and people who've been exposed to a known, confirmed case of coronavirus infection are at greatest risk. Risk does not depend on what a person looks like, their race, or their ethnicity. As has been mentioned, the risk of novel coronavirus infection in the U.S. is low. There's only been one case in Washington State, and coronavirus is not spreading anywhere in the community, locally or elsewhere in the U.S. But it's important to keep in mind that this is a rapidly changing outbreak and things will change over time. We expect more cases to be identified both internationally and in the U.S., including possibly locally before the outbreak ends. Currently, our efforts are focused on identifying and containing new cases of disease in order to prevent spread. This approach will provide additional time to learn more about the virus and, importantly, to prepare should a large outbreak occur. The CDC is preparing as if this will be the next pandemic, and I think we should all do the same. Now, in public health, we've been in close contact with our colleagues at CDC to be sure we have the most accurate information and guidance about this new infection. We're working closely with our community health providers and our hospitals to promptly identify any possible new cases for evaluation and testing if needed in order to minimize any risk of spread. And to date, Public Health Seattle and King County has assessed over 150 people for novel coronavirus exposure. We've tested approximately 10% of those. 15 persons met the criteria for testing. As you know, 13 of those have come back negative, and 2 people are still awaiting results, but we do not have a high index of suspicion that they will be infected. We're also currently monitoring close contacts of people who've had contact with the novel coronavirus case that was reported in Snohomish County previously, and people who've returned from China in the past 14 days to be sure they've been adequately evaluated and can take steps from preventing the spread to others if symptoms should develop. It's not possible to predict the ultimate course or impact of this emerging outbreak, but we can do a lot to prevent the spread of this disease through tried and true public health interventions. Don't go to work or school if you're sick. This is the same advice we give people every influenza season. Cover your cough. Wash your hands. Don't touch your nose, face, mouth, or eyes unless you wash your hands first. We don't currently have an outbreak of novel coronavirus here in King County or in Washington State or in the U.S., and we certainly don't want to have an outbreak of fear, stigmatization, and discrimination either. It's important for us in the public health community and in the community at large to prevent both of these outbreaks. Earlier today, we had an opportunity to talk with our community partners and hear about the impact to individual sense of safety during outbreaks and some of the stories of discrimination, inaccurate information, and rumors. One example we heard about was the stigma that can occur when people wear masks in public. And although it's important to understand that public health doesn't currently recommend that people wear masks when they're in public because, 1, there's no coronavirus outbreak happening currently, and 2, they're not known to be effective in preventing infections when worn in public. Keep in mind that some people do wear masks for personal reasons. There are cultural reasons why people wear masks, and there are social and stylistic reasons why people from other cultures sometimes wear masks. So if we see our friends, our neighbors, or our community members wearing a mask, we shouldn't assume that they've been exposed to a coronavirus or any other virus. In fact, we shouldn't even assume that they're ill in any way. In closing, let me emphasize that the novel coronavirus is not unique or specific to any racial or ethnic group. If this virus comes to the U.S., it will be an equal opportunity employer. I currently appreciate the partnership that we have in King County to stand up and prevent stigma each and every day during disease outbreaks, and we're deeply committed to work each day with our communities to ensure that they remain as safe and healthy as possible. And with that, I'll turn over the podium to my colleague, Sharon, for moderating a Q&A session.
Thanks so much. Thanks again for being here. So I first want to open questions to anybody from Chinese-speaking media. We have Mandarin interpretation. So if there are any questions first, I'd like to take a couple there.
所以我是在这里做中文口译，所以如果你们中文媒体有什么问题的话，可以提问，我可以帮你们做翻译。
Okay. So we'll go ahead and take a few questions for anybody on the panel.
Lady, Sharon?
Yeah?
I think she had a question.
Oh, please.
Hi, my name is Coco, and we are from Asian American Television. So far, from listening to what you guys say, washing hands is the best way to prevent and avoid having the getting sick or illnesses. As in flu season, is there any way, before or not only washing hands, any other ways to prevent or to avoid getting sick?
Yeah. Thank you for the question. So there are several ways that people can keep themselves healthy from respiratory viruses like influenza, and these are the same measures that we're recommending to keep people healthy from novel coronavirus should it become common. And so what this means is, first of all, very important, if you're sick, don't go to school, don't go to work, stay home and stay away from other people. Don't be out in public. So sick people, and this is the advice we give every year, don't be around others if you're ill. Secondly, yes, hand washing, very important, because we know that these viruses can live on hands, especially if someone coughs or sneezes into their hand and then touches other surfaces that can be contaminated. So good hand washing, and if you don't have access to hand washing, using a hand sanitizer, alcohol-based, 60% or more alcohol is a good option as well. Secondly, if you do cough or sneeze, cover it. Cover it with your elbow, okay, which is a good way to do it. And then finally, if you're ill and you are worried about your symptoms, see a healthcare provider. And if you're one of those people who's recently traveled to China at this time, it's a good idea to mention that. We recommend you tell your healthcare provider so that they can be prepared to evaluate you, if necessary, for a possible coronavirus infection. But again, it's really important to understand that this infection is not spreading in our community right now. The one case that was reported in Washington State is recovering. That everyone that's been in China in the past 14 days that we've been aware of, we're in touch with, we're monitoring, people have been evaluated, no one has been positive for the coronavirus. So take those great precautions, what we call respiratory etiquette, stay home and away from others when you're sick, wash your hands frequently, don't touch your nose, eyes, or mouth with unwashed hands, and see a healthcare provider if you develop symptoms. Those are really good ways to prevent the spread of all viruses in the community.
Hi, I'm Dee Cairo 7. So, we heard about the woman in New York City who was wearing a mask who was attacked a couple of days ago, and an alleged assault related to this. But what exactly have we been seeing here in our community? You mentioned stigma towards people wearing masks, but have there been threats? Are people making more comments online, or have people actually said mean things or hurtful things to people of the Asian community? What exactly are we seeing that's spurring this meeting here?
So the reports that we're hearing are basically not as violent as what's happened in New York, thank heaven. But it is, people who out of ignorance are saying, oh, you're from China, you should, the racism part, go back where you belong. Or they jump to conclusions, you have coronavirus. And so this is what we want to address. We want to make sure people are educated. We also are in a time that's very difficult for many communities because racism, prejudice, and hatred have had an open license. And so now it's being layered with coronavirus. So there are resources. We have anti-bullying, anti-discrimination ordinances and laws in place, and public health will be putting up the information in terms of how people could report these events so we could track them and understand them and ramp up our education.
Yeah, please.
Where were these comments made? To whom?
Unfortunately, it can be as random as grocery stores, Costco, out on the street. So these are the kind of reports that we're getting, that people are just casually saying these racist comments to folks who look Asian.
And are these complaints being made to your department, or like how are you hearing about the reports?
So we are a community-based organization. We're not part of King County government or any government. We work with our community partners, so ACRS, CISC, and our staffs. You know, we basically report to each other, and that's why we've been raising some of these concerns. And I'm very, very pleased that Public Health is taking it upon itself to also address this as part of the coronavirus.
I'll just add, and maybe we'll have one example too of somebody who personally actually had a situation. But one of the things that we're trying to make sure that people know is that there are some resources, whether you're in schools, you're in a business, you're a place, public setting. Discrimination is actually not legal, so it is reportable. And one of the things that we want to make sure is that people understand that they can actually have recourse. And also we're trying to actually train and share some tools in terms of what people can do in the moment if they see it. But this is actually something that's quite widespread. I mean, I would say there have been probably hundreds. We probably each have heard a handful of these, but when you begin to multiply them, it's throughout the community. So that's what's really concerning for us. Gonna invite.
Hi there, my name's Devin Cabanilla, and I'm a resident on the east side. My child, my son, and my wife were turned away at a store because my son was wearing a mask and my wife looks Asian. So she's Korean American, and my children are fifth-generation Seattleites now, and they were treated as though they were possibly from China. And the person at the store we were at was afraid she'd be infected. So that's just one example that I've had to deal with personally. And additionally, people in my neighborhood in the east side, they've been indicating receiving harassment and afraid to report it. So my big concern is that there are many people in the Asian American community locally who may be experiencing things but not reporting them. And I would encourage any of those community members to reach out and report that to whatever local officials are in their area.
Deb, I'm sorry to hear that your family is going through that. Can you say what store?
This was at Costco, and it was one of their third-party food sampling vendors. And done not much more with Costco. The CEO of Costco apologized to me directly, and so did the store manager. And this was in Issaquah. So the only contact I've had is with them directly, and we renewed our membership last week. So
We'll take two more questions. Yeah, please.
You talked about the celebration tomorrow. I mean, are there efforts to kind of get this message out, or anything relating to this you want to talk about in light of that?
Hi there, I'm Monisha Singh. I'm the Executive Director of the Chinatown International District Business Improvement Area. And we are here to celebrate Lunar New Year in our neighborhood. So our message is to tell everyone that our event is happening this Saturday from 11 to 4. Our businesses are open, and we have a fun day of festivities planned.
Oh yeah, Naomi.
Hi. Just a question for Jeff. You had said that 150 people were screened. How did you encounter those 150 people? Like, what flagged you to them?
Yeah, thanks for the question. So it's about how does the Public Health Department identify people who might need testing for novel coronavirus infection. We hear about these cases through a variety of different channels. Frequently, a healthcare provider will call because their patient has come to them and reported a travel history and symptoms, and they want consultation about the criteria for testing, whether this patient should be worried or not, or is at risk. Sometimes people will call us directly and say, I've been traveling and I've got a cough, and we'll try and do the assessment to understand whether or not that person really is at risk or not. And sometimes we'll hear about travelers through our colleagues at SeaTac Airport, our CDC, Centers for Disease Control and Prevention colleagues, who are screening travelers coming in that started on February 3rd, and they'll let us know someone's coming in, and then we just touch base with them. And if they develop any symptoms, that would be another way that we would hear about them. And then finally, we had the case in Snohomish County a while ago, and that person had close contacts, some of whom lived in King County. So if any of those people develop symptoms, they would be someone that we would also do an evaluation on. So those are the most common ways we hear about people.
Is everyone getting screened now from SeaTac who's coming from China?
Yes, currently what should be happening is all arrivals from mainland China should go through screening at SeaTac Airport, and people whose end destination here is in King County, we should get a heads up about from our colleagues at the airport, and then we just touch base with them by phone. They self-monitor at home. And by the way, someone pointed out to me that it might be good to just explain a little bit about what quarantine is, because it's kind of a scary, long word. And quarantine basically just means staying away from other people, practicing social distancing, and monitoring your symptoms. So when we say people are under self-quarantine or quarantined at home, what that means is we've asked them, and they uniformly agree to stay home, away from other people for 14 days while they're healthy, and then let us know if they develop symptoms, so then we can get them tested if they need it.
Just real quick, if someone sees stigma or experiences it, who exactly should they call to report this incident?
So Matthias Valenzuela, I'm with Public Health, their equity director. So we're going to be putting resources on our website. It's a whole toolkit around this. There are civil rights offices and programs at the City of Seattle, at King County, and at Washington State. So there are forms you can fill out, you can actually call in, and they'll intake your situation, and they will investigate.
Thank you all
Hey,
for being
before we
here.
finish,
Oh yes.
I'd just like to add one thing to the important question that you asked about how to stay healthy, at this time. And so I just want to reiterate, because I had forgotten one thing when I answered your question. So clearly, stay away from other people who are sick, and stay away from others when you yourself are sick. Cover your cough, wash your hands, use alcohol hand sanitizer if you don't have an opportunity to wash your hands. But also remember, it's flu season. Get vaccinated. There's still time to protect yourself from influenza through vaccination.
How do we know if people are sick or not? Because when the very beginning sessions, that we don't even know if we are sick.
Yes, when you feel sick, the guidance is, you have to know that you're not feeling well in order to stay away from other people. So the recommendation is, when you're not feeling well, you stay away from other people. If you're feeling well, you're very unlikely to spread a disease to someone else.
What I mean is the others, like we don't know the others if they are sick. Like,
Yes. Okay. So how do you know if someone else around you is sick? If someone else around you is coughing or sneezing, it's a good idea to stay away, at least 6 feet away. And in general, if you're coughing or sneezing, you shouldn't be, going to work or school or being around other people. If you're ill with fever, coughing and sneezing can be due to lots of things. Some people have allergies. Some people have reactive airway disease, chronic cough, and so on. We're talking about people who have an acute illness, something new, typically with fever, cough, and sneezing.
Yeah, we'll do maybe a couple more questions after we wrap up. I appreciate you all being here today. And we'll wrap up, and I think Dr. Dushin could take a few more questions off camera. Thank you all for being here.